Gestational diabetes is a growing concern globally, with significant implications for maternal and neonatal health. Gestational diabetes is a condition characterized by high blood sugar levels that develop during pregnancy and usually disappear after giving birth. It occurs when the body cannot produce enough insulin to meet the increased needs during pregnancy. Insulin is a hormone that helps glucose move from the bloodstream into the cells, where it is used for energy. During pregnancy, the placenta produces hormones that can lead to insulin resistance. If the pancreas cannot produce enough insulin to overcome this resistance, blood glucose or sugar levels rise, resulting in gestational diabetes. Recent research provides valuable insights into the prevalence, risk factors, and management of this condition. According to the International Diabetes Federation Diabetes Atlas, the prevalence of gestational diabetes is increasing worldwide. Approximately 14 to 15% of pregnancies globally are affected by gestational diabetes. This translates to about 21 million live births each year. A study published in the journal Diabetes Care in 2022 found that in the United States, the prevalence of gestational diabetes has been steadily increasing. In 2021, it was reported that about 6 to 9% of all pregnancies in the US were affected by gestational diabetes. In Europe, the prevalence varies widely by country, ranging from 5% to 24% of pregnancies, depending on the diagnostic criteria and population studied. The exact cause of gestational diabetes is not known, but several factors contribute to its development, including hormonal changes during pregnancy can interfere with the body's ability to use insulin effectively, leading to insulin resistance. Genetics or family history of diabetes can increase the risk of developing gestational diabetes. Pre-existing conditions like polycystic ovarian syndrome (PCOS) can also increase the risk of gestational diabetes. Gestational diabetes often does not cause noticeable symptoms. However, some women may experience increased thirst, frequent urination, fatigue, nausea, blurred vision, recurrent infections including UT, skin infections, etc. Since symptoms are not always present, routine screening during pregnancy is essential. Gestational diabetes is typically diagnosed through screening tests conducted between 24 and 28 weeks of pregnancy. The two main tests are 1. Glucose Challenge Test (GCT), in which a sugary solution is given to the person and blood sugar level is measured after 1 hour. If the result is higher than normal, a glucose tolerance test is required. 2. Oral Glucose Tolerance Test (OGTT) is done after fasting overnight. The blood sugar level is measured. Then a sugary solution is given to the patient and their blood sugar levels are measured at intervals over the next 3 hours. Effective management of gestational diabetes is crucial for the health of both mother and baby. Management strategies include balanced diet. Focus on whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables. Limit refined sugars and carbohydrates. A registered dietitian can help create a personalized meal plan. Exercise helps regulate blood sugar levels. Aim for at least 150 minutes of moderate intensity exercise per week, such as walking, swimming, or prenatal yoga. Always consult your healthcare provider before starting any exercise program. Regularly checking blood sugar levels helps ensure they stay within the target range. Your healthcare provider will guide you on how to monitor your levels at home. If diet and exercise are not enough to control blood sugar levels, insulin injections or oral medications may be prescribed. Frequent visits to your healthcare provider are essential to monitor your health and the baby's development. If gestational diabetes is not managed properly, it can lead to complications. For baby, the complications may include excessive birth weight, which can lead to delivery complications, preterm birth, respiratory distress syndrome, low blood sugar hypoglycemia after birth, increased risk of developing type 2 diabetes later in life. For mother, the complications may include high blood pressure, increased risk of cesarean delivery, increased risk of developing type 2 diabetes in the future. After delivery, gestational diabetes usually resolves. However, it is essential to monitor blood sugar levels postpartum to ensure they return to normal. Follow up with your healthcare provider for a glucose tolerance test 6 to 12 weeks after delivery. Maintain a healthy lifestyle to reduce the risk of developing type 2 diabetes in the future. Gestational diabetes is a manageable condition with the right approach. By following a healthy diet, staying active, monitoring blood sugar levels, and working closely with your healthcare team, you can manage gestational diabetes effectively and ensure a healthy pregnancy and delivery. If you have any concerns or need personalized advice, don't hesitate to reach out to your healthcare provider. Remember, taking care of yourself is the best way to take care of your baby.